Welcome to Part 2 of Tutorials on Systematic Review. We hope you have previously completed the Introduction to Systematic Reviews tutorial. Part 2 will cover the importance of a literature search in systematic reviews. Let me give a brief introduction about the systematic review process. The key difference between literature review and systematic review is that literature review is an overview of current knowledge and theories of a specific topic, whereas systematic review is a type of review that uses analytical methods to collect and analyze secondary data. Both literature reviews and systematic reviews are used to provide summaries of available literature or research on a given topic. Systematic describes the review's methods. It means that they are transparent, reproducible, and defined before the search gets underway. That's important because it helps to minimize the bias that would result from cherry-picking studies in a non-systematic way. This brings us to literature reviews. Literature reviews don't usually apply the same rigor in their methods. That's because, unlike systematic reviews, they don't aim to produce an answer to a clinical question. Literature reviews can provide context or background information for a new piece of research. They can also stand alone as a general guide to what is already known about a particular topic. Let us see what a research question is. The first step in a systematic review is to formulate a clear, well-defined research question of appropriate scope. The research question is a question that a study or research project aims to answer. This question often addresses an issue or a problem which, through analysis and interpretation of data, is answered in the study's conclusion. In most studies, the research question is written so that it outlines various aspects of the study, including the population and variables to be studied and the problem the study addresses. Asking the right questions can help the researcher collect relevant and insightful information that focuses on the research, determines the methodology and hypothesis, thereby guiding all stages of inquiry, analysis, and reporting. What is the Pico model? Pico is a protocol model which defines a research question. Various protocol models are available, such as PEO and PCC. However, the majority of the researchers choose Pico, as it is more suitable for clinical studies. By clarifying the Pico terms, the question can be constructed by the framework, where P represents patient, population, or problem. I represents intervention, prognostic factor, or exposure. C represents comparison of intervention. O represents the outcome you would like to measure or achieve. Let us take the example of the following research question. In adult patients with systemic lupus erythematosus, or SLE, is consuming turmeric tea more effective than Plaquenil at reducing joint pain? From the research question, the following PICO components are identified. P. Patient, population, or problem. Patients with SLE. I. Intervention, prognostic factor, or exposure. Turmeric tea. C. Comparison of intervention. Plaquenil. Standard drug therapy. O. Outcome you would like to measure or achieve. Reduction of joint pain. Once the researcher has formulated and identified the PICO components, the researcher now needs to identify the nature and study design to answer the question. There are various types of study design, and it is important for the researcher to identify the most appropriate type of study design from the given list. Randomized controlled trials, case-controlled studies, cohort studies, case reports, therapy, diagnosis, prognosis, etiology, or harm. Which study design is appropriate for the current sample case? In the current research topic, the question here is to address the treatment. In the cases where treatment or therapy is involved, randomized control trial is the best study design to answer the question. So the researcher has identified randomized control trial is the best study design to answer the question. Hence, the researcher has to look for studies that are randomized controlled trial in nature while searching for literature. After the type of question and the study design are identified, the researcher should investigate if this question has not been undertaken in the past. Defining the question with PICO and identifying the type of question and studies requires specialized knowledge. This is where the information specialists at the medical library will be most helpful for the researcher. Conducting systematic review is a team effort. This helps to conduct the review in an unbiased manner and avoid any biases. After defining the question and identifying the type of study, the researcher has to identify the members of the team. Members who have sufficient knowledge in conducting such systematic reviews should be selected as reviewers for the study. Examples include the main researcher, biostatistician, information specialist, and reviewer. The team is not limited in number. After setting up a team of reviewers, the researcher needs to create a roadmap called the review protocol. Review protocols generally follow a standard template provided by Cochrane, Prisma, CRD, or IOM. It will detail the complete process, start to finish, of how the review is to be conducted. Components of the standard protocol include the following: theoretical understanding of the review question, inclusion and exclusion criteria, the resources or databases to be searched, and the search strategy, data extraction and synthesis procedure, study selection, quality or risk bias, record-keeping practice and timetable. After creating a review protocol and setting up the team of reviewers, the researcher can start to search for the reviews in the predetermined resources or databases. The most important part of the systematic review is how the researcher builds up the search strategy and conducts the searches in various databases. All databases are not equal. Therefore, the search strategy is vital to ensure the credibility of the information and includes subject-related electronic databases, reviewing of references from relevant articles, searching in both published and gray literature, print resources, information from experts in the subject. After the search exercise, the research team members will start the process of reviewing the searched literature. This involves selecting the most appropriate studies from the search results for reference, inclusion and exclusion criteria, detailed guide for inclusion and exclusion criteria, detailed record of excluded studies and the purpose of their exclusion. At least 2 reviewers should critically appraise the identified citations to avoid biases. Review of the information is done to check if the literature is relevant to the research topic and supports the Pico analysis. The general procedure of reviewing the title and abstracts of the literature followed is the foremost step. The next step is to read the full text of the studies. A review of information is done to check if the literature is relevant to the research topic and supports the Pico analysis. The general procedure of reviewing the title and abstracts of the literature followed is the foremost step. The next step is to read the full text of the studies. Generally, the review of literature is conducted by 2 or more members of the research team to avoid any bias. Bibliographic information of the studies to be assessed should be masked before reviewing by the reviewers, to avoid bias that may have an effect on the overall objective of the research. Once the full text review is completed and the studies are selected to be included within the systematic review, the next step is to extrapolate the data for further analysis, data mining, to answer the question or protocol. Tools designed for data mining include specially designed forms, data extraction, and management software. Following completion of data mining, the next step in the review process is to organize the data collected. Organization of the data helps to compare and summarize the results of the studies. The most common statistical method used is meta-analysis. Meta-analyses statistically combine the results from multiple studies to calculate the overall or absolute effect, and may also be used to verify any variations. The results of a meta-analysis are usually presented as a graph called a forest plot. A forest plot typically appears as a forest of lines. It provides a simple visual suggestion of trends of individual studies stacked on top of each other to quickly and efficiently scan and interpret the evidence. After plotting the results, the researcher needs to analyze and interpret the findings. Knowing the structure of a forest plot, type outcome measures, heterogeneity, and risks of bias assessment will help us understand the results of the systematic review. In general, the writing process for systematic review is similar to writing of any other kind of review. It should provide an answer to the research question and describe the search process and selection process, methodology. The structure should reflect the stages outlined in the protocol, Prisma, and focuses on the critical reflection and interpretations of the findings. The systematic review should tell a story, and needs to clearly articulate how it provides meaningful, original advancement of the field. We have come to the end of this session. We hope this session was helpful for you to understand the systematic review process. If you have any further questions, please contact your librarian.